Eye on Health is sponsored by Goshen Health. You're watching WSBT 22 News at 5.
February is American Heart Month, and we're putting our focus on congestive heart failure, what it is and how it's different from other heart diseases. We go to Goshen Heart and Vascular Center for tonight's Eye on Health. At Goshen Heart and Vascular, heart health is a top priority. Dr. Blair Macphail is an interventional cardiologist there.
Congestive heart failure is where the heart's unable to keep up.
There are two different types.
Some patients have a reduction in their ejection fraction, and that's the first group because their heart's weakened and they just can't contract to that degree. Other patients have a preserved ejection fraction where the heart chamber is not as elastic. It's harder to fill the chamber. It's stiffer. So there's a slowing of its ability to relax and receive the blood. And that's the diastolic dysfunction. The two groups are about 50-50 in their presentation. So half of all heart failure, the heart functions normal. It's just that the diastolic part of the filling of the ventricle is abnormal.
So what are the warning signs?
We look at, as you said, the symptoms of shortness of breath. People have trouble lying down at night to sleep because they're getting smothering or short of breath. People wake up short of breath.
You may feel weak or fatigued, even a loss of appetite. Special imaging can help determine which type of heart failure a patient has. As far as who's at risk?
Common causes would be coronary artery disease, heart attacks, poor blood flow to the heart muscle, anything that reduces the contractility or systolic function. Another common cause would be a viral infection. Sometimes the immune system gets confused and it will injure the heart, or the infection can actually affect the heart muscle directly.
But it is possible to treat with medication, diet, and exercise.
Lastly, there's always something on the horizon. So in this newer group of diastolic dysfunction, they're looking at certain medicines that are anti-inflammatory because they feel like, at least theoretically, that's the underlying process.
With regards to treatment, some of the things that work really well for patients being treated for congestive heart failure: restricting salt in your diet, losing weight, reducing stress, cutting out alcohol. Those things can be very effective.